everyone. My name is Lani Tinam Gidado. Welcome to the Play to Heal podcast, where we talk about the therapeutic powers of play and the journey of a play therapist in the playroom. So join us as we engage in reflective and playful conversations and explore how we can heal through play across the lifespan. And don't forget to hit that subscribe button. Thank you.
Hi everyone, I remain Sam. Welcome to another episode of Play to Heal podcast by the Association of Play Therapy Nigeria. You guys don't want to know what is happening right here. Man, we have somebody so special. We're so happy to have her with us here today. With me here I have Mrs. Patience Dimka. Welcome, ma.
Thank you, Sam. I remain Patience Dimka because Sam remains Sam.
Yes.
So my name is Patience Dimka. I am a clinical psychologist. I work with an organization called Back to Back, and we do orphan care. We provide help. We work with children who have gone through trauma, children who live in orphanages, and we just try to support the organizations that work with them as much as we can.
Wow. It's so nice to have you here. You know, when I was about introducing you, I remembered that this morning I called you Miss Patience.
Yes, and I have to report it to Miss Ladin. He's 19 years of marriage. He will not hear.
Yeah, please forgive me. Okay, so let's delve straight into the topic for today.
Right.
Yeah, so we'll be talking about addressing childhood trauma through play. So, you know, you've introduced yourself, and of course, I'm sure you, as part of your practice, you use play therapy, right? Yes. Okay. So I would just want to ask you, what do you think is the transformative power of play when it comes to dealing with children who have suffered from childhood trauma, or even adults who have suffered from childhood trauma?
Yes, so Sam, I'd like to also add, most importantly, recently,
Okay.
that I'm a play therapist in training.
Okay, yes.
So I mentioned that I'm a clinical psychologist. I've worked with children, and the aim is to just help them heal from trauma. And we did a whole lot. I can't tell you how many times, Sam, I apologize in my mind to the children for using what works for adults for children.
Wow.
Because I didn't know any better.
Wow.
But now, yes, what play therapy does is it allows the children to, be their authentic self, and then try to process emotions that they are going through. Because trauma affects in so many ways, affects the brain, the nervous system, the belief system. And so they have a lot of emotional issues that you want to address. Play therapy gives them the space and the freedom to process that on their own and find solutions using what works for them, their work, play.
Yeah. Wow. That's profound. You know, I've heard these quotes, I think it's by Maria Montessori, something about play being the child's work.
Yes.
So it's, from what you said, I want to believe that it is more like going to the language of the children, just like you mentioned, that what works for adults might not really work for kids, right?
Yes.
Wow.
Sam, it's almost like you have a new baby
Mm-hmm.
who has not started talking.
Yes.
And then you're using big words. Like, imagine you're telling the child to tell you things the way that only adults get.
Wow.
You know how babies
It won't
talk.
work.
Baby
Yes.
talk. That's, if you do that, they will smile and do that with you, right?
Yes.
So you're doing that back and forth. But what we do usually is in trying to help them. We use big words. We use what even adults struggle with. So many times I tell people, why will you be on admission, Sam, in the hospital, and I say to you, how are you? And then you say you're fine. Because you can't deal with, okay, this is what I'm feeling. We're not even expressing that. Talk more of children. You should see how children just are natural. That's the gift that God has given them. That's the way that they know how to communicate, how to talk, how to play.
Mm-hmm.
have you seen them play? Have you seen children play? It doesn't look like it's like you sitting on your laptop.
Yes.
It's that serious for
Wow.
them. So yeah.
Wow. You just mentioned something that I feel like is very interesting. The fact that, okay, you might see somebody who has gone through trauma, and I don't know that to call it self-denial. That place where you are telling somebody that, okay, how are you? And the person is saying, I'm fine. Regardless of, okay, we can all see. So do you have an idea what is in play when somebody is actually passing through trauma and you're like, okay, how are you? And the person is claiming, I'm fine. Regardless, you can see that the person is not feeling too well at the time. So I don't know. Can you speak to that?
I think it depends on the individual, but I can say sometimes it's just that the person does not know even how to express what he or she is feeling or going through. But most importantly, because we're Nigerian and Africans, we don't allow room for such. People proudly tell you, I have blood pressure, but they won't tell you, I'm going through this issue emotionally, because you're going to look down on them. You're going to say, if a woman is saying, I feel depressed, you're going to be like, you're not God-fearing, or you're not a virtuous woman, or you just put it to her in ways that, we don't make it safe for people to even share and say, do you know I didn't sleep last night because people don't say I feel depressed. Yeah. Because once you say that, you mean that, so I'm mad.
Yes. Like psychologically. Yes. Because for the most part, I think thinking about it now, you hear people saying that, okay, how will you say that, just like you said, you are feeling depressed, and okay, where's your faith and all of that? Are you not a child of God? So do you feel like you found a balance, like between, okay, somebody saying, okay, I have faith for this thing, and like in reality, what is happening?
Yeah, do you know, I think that we are holistic.
Okay.
And so the way that we'd like to encourage people to look at themselves is you have the physical part of your life, you have the spiritual part of your life, you also have the emotional part of your life.
Okay.
So if one is affected, it will affect the others. But you need to know what it is. If I have a physical injury, I know what to do with it. But how about if I have an emotional injury?
Yes.
Why is it okay for you to
take Panadol for headache, but
and not do?
Wow, that's profound.
So yes, we just need to, work as God created us to be holistic and not just in segments.
Yeah. So using play therapy, do you think that there is a way that you could use play to prevent trauma for children? Is there any way? I don't know. I don't know. I'm asking if there's a way that play can be used as a form of, like putting play now in place, and then at the end of the day, saying that the reason why I want these children to play is that, okay, so that they don't experience traumatic. Yes.
Yeah. So play is like the language of the children, and toys is like the words that they use.
Wow.
It's like saying you don't want children to talk.
Wow.
When you stop them from playing. Or you want children to be adults. You know how uncomfortable it is?
Yes.
I think the problem we have, Sam, is that we want children to be adults. You just come and drop your child and say, do this, sit this, and do. You're giving instructions so that the child represents you in a way that is not childish. You want the child to just be, you don't want to stress over that. It's like trauma healing. We always say that it prevents and heals. Wow. So you can't choose and say, if you work with a group of children, you can't say, okay, I'm going to do a trauma-informed approach to just children who have gone through trauma.
Yes.
And then leave the others. No, it prevents and also
at the same time.
So play is good for children. When are they going to play? It's not when they get to become adults, right?
Yes.
So while it is time for it, let them do that. We never even get tired of play. We still play up to now.
Wow. Yes, we still play. Yes.
You have this look on your face like, I have to go and play.
Yes. After now, yes. Yeah. I'm actually looking forward to our tea party, right? Yes. Because there's going to be lots of PlayStation. Yes. When we mentioned PlayStation, it was sounding like
the computer.
Yes. Yes. So as regards challenges, like in using play therapy to address children who have suffered from trauma? Are there challenges you faced? Personally?
Yeah, because you're used to a certain way. So I understand when people say, what do you mean play? Is therapy again?
Yeah.
I bet too much play and all of those things.
Yes.
You know, if you're used to a certain way of doing things, if you don't know the importance, don't know the why, sometimes it's hard to just change. Even when I know the why, sometimes I'm in training, like I said.
Yes.
I think my biggest struggle is to watch the child and not say anything and not do anything, or allow the child to explore, to find him or herself. That has been a challenge. So yes, in applying this new principle that we have, it's very new in Nigeria.
Yes.
And a lot of people are training now, and we're happy and glad that Sigida is championing this thing.
Yes.
But it's new, and it goes against what we believe most, what we're used to.
Yes.
You know, children play too much. There's time for being serious. We don't know that even in playtime is a learning time.
Yes.
Is for them to grow.
Mm-hmm.
It's the same way they're going to approach issues outside when they grow and all of that. So we think that play is just play. It doesn't have any benefits. So there are a lot of challenges with how we saw play as against what we're now saying about play.
Yes.
But the challenges, I can tell you from me, the benefits, they outweigh those
challenges. Yes.
Yes. So I want to go through it. I want to go through the pain of watching and not doing, because I know the benefit for the child.
Wow, that's interesting. So there was something you mentioned about, I think misconceptions. So okay, how do you deal as a professional? How do you deal with misconceptions from people, from parents? Okay, for example, just like you mentioned, okay, play is just play, some people would say, and all of that. So how do you deal with those misconceptions? How do you, at the end of the day, how are you able to tell probably a client or a parent that, okay, this thing is actually useful for you? How are you able to scale those misconceptions?
I think mostly the results of play therapy.
Wow.
It speaks a lot. It's science.
Yes.
It's the truth.
Yes.
There's nothing we can do about it. But most times, sometimes when you ask questions that help parents to reflect, doing this thing, what did you see? Or you come up with facts because of these things that I've observed, you're presenting the things that the child showed you.
Yes.
They see it and they know that it's true. Did you get this through this?
Mm-hmm.
So I think it's the result. And then it's also explaining. I had the opportunity, Sam, of talking to some parents in a church about play.
Wow.
And I was just talking about play, and one of them said he can see the difference. When you talk about play and the benefit,
yes,
it's obvious because we all have played.
Yes.
And we like to play.
Yes.
Or we have stopped playing and we know the effect.
Yes.
So you find yourself just thinking and reflecting and saying, yes, it's true because I have felt this. I used to play. This is what it felt like. This is it, and these are the benefits. This man said to me, I have children. I see how I was raised, and I see the way that it has affected me, and I see myself doing that to my child, and it's because I was not allowed to do this play. I'm stopping my child, but I can see the disadvantages. So it's the facts that present, and you see, if you think honestly about it, you have experienced it. You know someone who has, or you have stopped playing, and you know how it feels like to be that serious. So yes, just the fact, and it's true.
Wow. The question was just coming up in my head, okay, with your experience dealing with children or adults that have had traumatic experiences, to what extent will you say that if those things are not addressed, for example, a child having to process a kind of emotion, like a negative emotion they felt when they were little, maybe because of an event, to what extent will you say that that can affect the child, when the child grows up?
Sam, it's very sad. But it will affect your whole life. It will affect your productivity. Wow. It will affect what you become. Trauma changes you from the core of who you were meant to be.
Wow.
So you become something else. Do you know, we have children who have gone through trauma, who have not dealt or processed emotions, or have not got healing, who are now husbands.
Yes.
Who are struggling.
Yes.
You have husbands who cannot express themselves, who cannot talk about issues, who avoid things, or who fight or do this because of their own trauma. Wow. You see it at work, your colleagues, your friends. There's no way you carry it. It's not like when I'm leaving home, I'll keep my trauma. What I'm saying, what I'm doing, is as a result. Most times when we say, when you see a person behaving a certain way, when you go back and find out what has happened to him, most times it's not anger you feel, but you feel empathy.
Wow.
And you feel sorry for the person because it's like something is pushing you to do what you're doing. Maybe unresolved. Because by the time it's resolved, the person becomes a better person. And we're growing every day.
Yes.
But trauma, people always say that. They say, it happened a long time ago, so we're not going to talk about it. But guess what? That thing you hid in your closet is showing up in your tone, in your relationship, in your emotional, kids who have gone through trauma. There are things that happen in life that are not supposed to be. The way they react is too much. That's what you say.
Wow.
You wonder how a child will begin like the same situation, but the way that they react to it, you know that it's like these big emotions they use.
Yeah.
It's something that triggered that. So
wow. This talk is getting so interesting. I feel like we should continue for like the next 1 hour. Okay. So you just gave an example that is leading to my next question. Okay, is it possible for trauma to be transferred? Like
to people.
Yes, like, okay, just like you gave an example, a husband, maybe having gone through traumatic experience when he was little, now has his own family. Is it possible for him to transfer that trauma to his children?
You can only give what you have.
Wow.
So if I grew up, and they always say it like, if I grew up in an abusive family where I watched my dad beat my mom,
yes,
the likelihood, at that point you don't like it. So most of them say, I don't want to be like this. I don't want to be like this person. But because that's what they got, your belief system is formed by your experiences and the words that you receive.
Yes.
The experience is what shaped you.
Yeah.
You go through life and you go and repeat the same thing. It's like a circle that has to be broken. Except one decides, I'm going to do this healing business, I'm going to be vulnerable, I'm going to say this. Because if you think about it, you'll be like, why are you doing this? It's because of this and this and this that you got. So yes, you only give what you have.
Yeah.
We do well to check ourselves as parents. And even our style of parenting is one that we learned. If you ask some people now, say, why do you spank so much? It's not like they sat down and then they decided,
study or something.
This is how we're going to. It's the way that comes naturally. That's what they receive. They're giving.
Oh my God. Yeah, that's profound.
Okay, so from what you said, so it doesn't matter how many times someone says, okay, I've been in this experience, I don't want to be like this.
Without doing anything about it.
So somebody grows up in an abusive home and say, I don't want to be like this. Maybe I saw this kind of pattern and I don't want to be like this. So no matter how much times, even if the person likes, let him write it on a paper. Like they used to give punishment when we were in primary school. They say, right, I'm sorry, 100 times. So no matter how many times.
If you do that, if you believe that and you say it every day, I also believe you need to work on it. Like, you need to replace it with something new, something that you think would work for you. It's like saying, this is how I grew up, but this is how I want my home for it to be. That means you have to plan for it, you have to work for it. There's so many times where you feel like doing what was done to you, but you have to restrain yourself, you have to train yourself to do differently. That's what we're saying.
Wow. So. That's interesting. So now, what do you think the role of caregivers are in, should I say, exposing a child less to trauma?
Let me try to explain something that we call in our organization the middle circle.
Okay.
So we have, for you to be trauma informed, you have to be trained, right?
Yes.
So you have the resources, you know what it means to be trauma informed. But then you have this child who has gone through trauma. That means bad things happen to this child, or good things that were supposed to happen did not happen. The problem you have, Sam, is that your resources are here and the child is here. Someone needs to bring these resources to the child.
Yes.
So that's the caregiver.
Yeah.
You have to be an adult who is intentional, who knows about trauma care, who is using it. You have to be present, you have to be consistent. So caregivers, they play a very, like, their role, I don't know how to say it, but it's huge.
Wow.
Because they're the ones who show differently what the children have experienced. They're the ones who help guide through the healing. It's like the play therapist who is in the room while the child explores, you know.
Yes.
So that's important. So when you get caregivers that are okay themselves, who have healed or are healing, they do a better job taking care of these children.
Wow. So or should I say, how would you consider a family who brings in a caregiver without knowing all of these things?
That's a risk, so except you're willing. And I say, sometimes you don't want to put in the work. If you bring a caregiver, you need to train the caregiver.
Yeah.
And you need to check on the caregiver. Like, if you bring someone to care for children, you have to care for the caregiver too.
Wow.
So the caregiver is the one who is like receiving all the things and giving, right? Once you keep giving and giving, your cup becomes empty. Who fills your cup? That's where we forget. We just automatically think that because you're a caregiver, you can do these things. That's where self-care comes in.
Yeah.
You can't give what you don't have. So you have to care for yourself to be in the right mental state for you to be able to care for another person.
Yeah.
So, yeah.
The reason why I asked this question was, in many cases, you would see where families, they just bring in this.
Even a small girl.
Yes, even a small girl, and just say,
Sure.
okay, so person is going to be taking care of our children from now on, right?
Yeah, it's sad. One time I went somewhere, someone was talking, and then she shared how she has a girl who is taking care of her children.
Okay.
And then I asked how old. The person that is supposed to take care of children was also a child.
Wow.
So what you're saying is this person should become an adult. So you're going to talk, you're going to act, you're going to treat the child as because he needs to care,
Yes.
take responsibility for these children.
Yes.
But then I ask always, your own child, would you want your child to
Yes.
be an adult for another child? No.
Yes.
But it's just convenience, and we're just choosing what is cheap. We don't want to put in the work.
Yes.
Because if you have a daughter, for instance, who is 10-year-old, she can take care of her siblings, right? But you have to train her
Yes.
to do that. So how can you just bring someone from the village and say, you take care of the children? Children taking care of children, I'm sure you can imagine what will happen. There will be a lot of pretense, there will be a lot of things that even your child will learn that you will not want for them.
Yes.
But how about you think about the child also as a child? Let me train them. And then when they
Altogether.
grow, they'll be able to,
Yes. And would you say that at the end of the day, that can be a traumatizing experience for that young child who's taking care of?
Of course. Asking a baby to be a mother or to be a caregiver is very traumatic. You're asking the child to do what is beyond the person's capacity to do. You're asking me to think not just for myself but for others and take responsibility for even you as a parent struggle with it at times, like you're wondering.
Yes.
I have a 17-year-old, I have a 12-year-old,
Wow.
I have an 8. Do you know, relating to them, and then a 4-year-old, like relating to them is different. It's hard work.
Yes.
I mean, so you don't expect one person. How will she think about the differences in age and how she needs to relate with this one and this one? All we're thinking about is the physical labor. Make sure the house is clean and that's taking away time from what the child is supposed to be experiencing at that time.
Wow. Okay, so my last question.
Okay.
If it doesn't lead to another question, she's already excited. We will not allow you go until you bless us. Okay, so my last question is on ethical consideration in trauma-informed play. Yes. So, can you discuss a little bit on confidentiality and informed consent and the responsibility of the therapist?
With
You
the
know,
child.
when it comes to confidentiality and informed consent.
Just, I think it was yesterday I had my supervision with Mrs. Kidado,
Oh wow.
and then I told her I took a picture, and then she said, how did I take the picture? I said, I tried to see when the child was not looking at me, then she said, how about you ask the child for permission
Wow.
to do that? And then she said, most times they say yes. So the children are not dumb.
Yeah.
They know what they want to. Most times they don't talk about so many things till they get to feel safe.
Yes.
Sometimes parents especially want you to tell them everything and they use it against the child. So you have the responsibility of protecting your client and then the parents, right?
Yeah.
But anything that is harmful, anything that is going to be detrimental to the healing or others is something you're obligated to share.
Yes.
But parents are usually, and most people are usually very impatient. So they just start telling me what's wrong with the child. But you as a therapist have to, time
Yes.
is what you need to be able to say this is it. Because if you bring a child to me, 1, 2, 3 sessions, you might not even know what is going on. You
Yes.
have to. So it takes time.
Yeah.
That time is what people struggle with. But if there's anything that's dangerous to any other person, even the parents or the child, the therapist is obligated to share. But most times the other things are just you still allowing the process to go on. And that's what people just want. People want to know. They're like, what's wrong with him? Why is it? Because you want to blame the child. You want to say there's something wrong with the child and not what
with me.
What is wrong. It's not what I'm doing that is affecting the child.
Yes.
If you say, for instance, because trauma is experienced differently.
Okay.
Even if we stayed in the same room with my sister.
Yes.
We experience it differently, and it depends on how my state is that time.
Mm-hmm.
If I leave my house with my husband, no fights, we're okay, we're happy, and I'm driving and somebody does anything on the road, I have more tolerance and patience. I'm like, what happened now?
Yes.
And then, but when I leave my house and everybody's late, everybody's angry, the way I'll react is different.
Yes.
So you can't tell another person what trauma is to that person. So you can't say, this small thing that happened is not trauma. So this child, if your parent traveled without letting him know, and is encoded in the child as trauma, it is trauma for the child.
Wow.
So yes, you have time to allow the process to happen. No quick fix.
Oh, there's no quick fix.
Yes.
So I know I said that was the last question, but from what you said, another question
came out of it.
Yes. So how do you deal with parents who would say, okay, tell me what's wrong with this child? Okay, after your first session, in fact, I'm imagining some of them will be waiting outside your door. They can't wait for you to finish the session and like, okay, so what is wrong with him?
Yes, let's just be done with this issue. And they would even ask the child, like, what did you say there? I hope you didn't make me look like this.
Was that not more traumatic? Like, I don't know, because for me, I feel like there are a lot of things that happen in our part of the world that for example, a child is crying and they are saying, okay, why are you crying? And then the child doesn't answer. Then you now be like, I'll give you a reason to cry.
Yes, as in this reason, why you're crying is too small.
So let me beat you.
Because you only cry for big reasons. That's why I said, Sam, what is traumatic to the child is not what you think trauma is.
Yes.
As long as this child says it's painful and he's crying. I've had somebody who said to me, his daughter came in and she was crying and he was like, what happened? She said someone said a bad word to her. Then he said, show me the wound. Is there a physical injury? She said no. Then he said to her, why are you crying? I said, because the words were painful to her.
Yes.
So, we always want it to look like, we want to shut a lot of the emotions instead of validating and saying, oh, is this what? Because it takes time, Sam, for me to say, okay, how did you feel when he said this thing? And then walk on. So we just want to say one thing that will shut
the other things.
I mean, so we make you think that your emotions are not valid. So don't show them.
Yeah.
Right? Like it's like saying to a boy, boys don't cry. No. So I wonder why you have eyes and the tear glands. Also,
I think for the most part is as a result of, just like I said earlier, and just like you said earlier, like, okay, most people don't know how to parent. The method they're using to parent is what they were taught or what they observed. Not even rightly, they maybe sat them down. Yes, more of what they experienced. Wow. It was a lovely time with you today. Don't worry, I'll let you go now.
I'm not worried. I enjoy my time with you here.
Before you go, is there something you want to say to us?
Regarding play therapy, because it's new in Nigeria,
Yes.
and a lot of people say, what, play? How is play? Therapy is even making it look. I want to just say that play is very important, and a lot of times we underestimate what we are saying because we simply say it's a time for children to pass time or just have fun. But I want to encourage and say that while playing is certainly a joyful experience for the child or even adults, even you, Sam, it is also an invaluable tool for helping children to grow, to foster connection and heal from distressing events. I can tell you that firsthand.
Wow.
Yes, so play is not just play again.
I said, do you mind giving us an example before you go? You said you could tell us that firsthand.
You know, my session with the child I was having recently, I was sharing with my supervisor and I was like, you know, I remember when the child started coming to the playroom and I would say something like, this is your space, feel free to. I saw how timid the child was. Till my last session, the confidence he came with, the way that, I mean, if he was solving a problem, I saw him do it with boldness, with calm, and like he knew what he was doing. It looked like it was play. But even if he was arranging or playing with a toy, he was doing it with such, you can even see it, the difference, the confidence is building. The approach to the problem is different from how he started the session. And imagine, have you been with children? Caregivers or parents who play connect more with their children than others.
Than the uptight serious
than the uptight serious. They always are afraid of them. But you know, when you're able to free, my husband is the playful kind. He'll play, he'll do this with them. You see how the children, one time I was asking my son, I said, do you want to talk to this? He's like, no, I can talk to daddy about it. That was really, I mean, you think it's nothing, but it's the way that you come down to their level. That it helps them to trust you and, you know, just share important things with you. So yes, there's so many. Even you, Sam, if you play today.
Yes, I think there's a way it elevates one's mood. Yes. Yes.
It helps you even put things in perspective.
Yes.
It helps you relieve stress even. And the hormones your happy hormones are activated. So you're a better person to be with.
Yes.
Because of your mood and your state at that time.
Yes.
So let them come and do the tea party and enjoy our time together.
Yes, our PlayStations.
PlayStations. Yes, that's what you call it. And it's nothing physical PlayStations that have to do sometimes even with sand and stones and whatever it is. But yes, come and unwind and just remember your childhood time or what you still have a child in you, just bring the child out.
Yes, definitely.
Yes.
Definitely. Thank you very much.
Thank you, Sam.
We definitely have you back here. Definitely.
Definitely.
Yes.
I'm privileged and honored to be here.
Oh, thank you very much, man. Yes.
Thank you.
So see you next time on Heal to Play podcast. Today we were here with Mrs. Patience Dimka.
Mrs.
Yes, I know sometimes. No, I'm not making any mistakes again. Okay, now thank you very much.
Thank you for having me.
Thank you for joining us on this episode of Play to Heal podcast with Lami Gidado, brought to you by the Association of Play Therapy. We hope you found inspiration and valuable insights into the transformative power of play. Remember, healing begins with a playful heart. If you enjoyed today's conversation, don't forget to subscribe and feel free to share the joy of play with others. Until next time, embrace the healing journey through the language of play.